I'd like to discuss with you this morning a very common problem that seems to be related to allergies, both the type of allergy that relates to skin contact and the type of allergy that's related to things you breathe and things you eat. Urticaria is a skin condition called hives, and commonly known as hives, and can affect people either with immediate severe reaction, which causes swelling of the tongue and lips and throat, which requires emergency room treatment. My grandson happens to have this reaction to milk. And it is so severe that if there is a trace of milk in anything that he comes in contact with, either touching his skin or if he ingests it, he gets asthma and giant urticaria of his the back of his throat, his tongue, and his lips. This is an emergency problem and must be taken care of, treated with steroids and adrenaline and antihistamines. Most people who have chronic urticaria or chronic hives do not have this immediate medical problem. It's not an emergency. They're treated with various antihistamines on a chronic basis and on an acute basis with corticosteroids or prednisone. It is a very difficult problem when the hives are so chronic that they appear daily, and there seems to be no rhyme or reason to why these things are occurring. In my practice, I deal a lot with delayed food allergies and acute food allergies, and this problem is more persistent and more of a problem for people when it is constant and repetitive. They're always taking antihistamines, some of which make them drowsy and affect their ability to drive and work, and others have to be maintained on steroids, which cause a number of side effects which are life-threatening and unpleasant, including weight gain and ulcers and diabetes and that sort of thing. So I look to those people who have chronic problems where they have hives on a repetitive daily basis to try and find the cause. The cause may be something as simple as detergent in the wash, or it may be a hand soap, as these contact issues need to be explored. However, once all of these things have been eliminated and it's obvious that this is related to something else, I start thinking about things that are eaten. It is important, if you can, to identify what things that are the cause, because if you can eliminate the cause, you obviously can remove the problem. In most cases, reactions that are immediate can be related to something that one's eaten or something that's contacting the skin. Typically reactions to like latex and other substances which are in contact with the skin, like detergents in fabric, are related to where that touches your skin. Typically, latex in gloves will give you problems with your hands, but it can be a generalized reaction also. I'd like to focus here, however, on those things which are difficult to get at, and those are hives or urticaria caused by chronic allergy to consume things like foods and additives. Most allergists and most dermatologists realize that there is some cause for these chronic problems, and most of the time we don't know how to get at the cause. So I would highly recommend those people who have been through all the routine treatments of salves and lotions and cortisone creams and potions, look at their diet as a possible cause of chronic urticaria. To do this, you need to test the individual with skin testing or RAS testing, and I feel delayed food allergy testing is a necessary part of a well-rounded diagnostic workup. If, in most cases where the immediate allergy tests like RAS and skin testing are either negative or equivocal, most likely you're going to find that the delayed food allergy testing done by Sage Medical Labs is very helpful in eliminating those foods which might cause your problem. I've had several patients who have been everywhere, including the Mayo Clinic and Cleveland Clinic, and have had no results in solving the problem because the doctors in those institutions are not aware of delayed food allergy problems. These delayed food allergy problems are not the same mechanism as the common allergies that we understand. And once that mechanism is understood and the foods are identified, the treatment is easy. Just eliminate foods that cause the problem, and you do not have hives or urticaria anymore. So I strongly suggest those people who have failed all other forms of diagnosis and treatment consider this as an alternative.